Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by Montgomery County's Caregiver Support Program. We have a special guest today, Odile Brunetto, who is the Chief of Aging and Disability Services with the county. Welcome, Odile, and would you please introduce yourself?
Lovely. Good morning, Lily. It's a pleasure to be here with you today, and I'm very happy to be able to participate in this time with you today so we can share information to our viewers. So, yes, my name is Odile Brunetto, and I am the Chief of Aging and Disability Services here in the county. I have been recently appointed formally as the Chief. That was in April this year by the county executive and the county council. Prior to that, I was acting in that position for about 2 years, in addition to working in my role of Director of the Area Agency on Aging, a role I've had for, I believe, about 12 years in the county. So I feel very honored to be able to serve our residents, families, and working with wonderful staff person like yourself, and multiple wonderful partners in the community.
Wonderful. It's so terrific to have you with us today. So, many people are curious about really what is aging and disability services and what are the kind of programs that they are and maybe how they've had to adjust with COVID-19.
Oh, certainly. So aging and disability services is one of the service areas in the greater department in the county, Department of Health and Human Services. And clearly our focus is to serve older adults, persons with disabilities and their families. And so the point of entry for our services is called the Aging and Disability Resource Unit. And there's one main number for everyone to call us if they want to access our services, and that is 240-777-3000. And so the program has been operating for decades in the office. We have about 8 full-time employees who are on the third floor in our office building, and they have a desk and they have a telephone, and that's what they have been doing, sharing their expertise with people in need for decades. And then COVID came upon us. And so pretty much overnight, they had to stop coming to the office and work from home. And so it was an adjustment, to say the least. First of all, we didn't have a lot of equipment. We didn't have any cell phones. We had to borrow cell phones from some other teams within the greater department. And then we had to get people computers so that they could work from home. So now that we are 5 months into this, they have gotten better cell phones, better computers. It's working really well. However, they are still able to do face-to-face meetings with people by appointment. For example, this morning I was talking with one of our wonderful staff who happens to be bilingual, and he had 2 appointments with 2 different persons in the parking lot, doing the distancing and of course wearing your mask, etc. And so that's something that the staff can absolutely do by appointment for people who absolutely must come and have an interaction with one of the staff. So this central telephone line is really a wonderful way for anybody need to talk about whatever is happening in their lives, where do they need help, and get started with a plan. And so this phone line is also where people call when they have a concern about a person who may be abused, exploited. And so the service that can be accessed is called Adult Protective Services, APS. APS is a mandated service, and if a neighbor, a friend, a family member, a colleague is concerned about a person 18 years old or older who is at risk, they contact our number, again, 240-777-3000, and then the caller is connected with a social worker who examines the situation and put a plan to alleviate this problem. And obviously, these are the kind of things that are difficult to do remotely. We can gather information over the phone, but there are certain things that must be done in person, absolutely. And so during all of the COVID months, the staff in APS has been able to conduct face-to-face visits and continue to do their outstanding work. Another group who has continued to do their work face-to-face are our wonderful home care team. Those are certified nursing assistants who go in people's homes for persons who are eligible to receive services. So the staff, goes in someone's home, helps them with bathing if that's what they want, with laundry, with cooking, uh, getting medication organized, etc. So we are very, very lucky that our wonderful home care team has been able to continue to deliver the services in people's homes during COVID. Clearly, our staff is equipped with the proper personnel equipment, the gloves and the masks, etc. And I just want to say I'm very proud that both the APS team and the home care team have received special awards this past couple of months because of the outstanding work they have done in the community for our residents in need. We have quite a number of services that we have continued to do remotely, that obviously in the past we did them face to face, but we need to follow guidance from the state. The Department of Health at the state gave us guidance that for some programs, like case management, for example, we were not to do site visits or home visits, but those services could be done remotely. So clearly we have complied with that, and we have continued to do that over the telephone or via Zoom technology if that's available to people. A program that has seen a huge change is our senior nutrition program. From the get-go, when the COVID started, the governor closed all of our senior centers in the state of Maryland, and they are still closed as of today. And so the senior center, when we don't have a pandemic, are a wonderful place to be. Seniors get together, they have plenty of friends, they have wonderful activities. And one thing that is also fantastic and essential is a lunch. They have a wonderful lunch. So when COVID began and the centers were closed, we clearly could no longer have lunches with hundreds of seniors getting together. So we switched radically, really overnight. We had to switch to do what is called grab and go. And so we have a packet of 7 frozen meals that people can come and pick up again safely. They stay in their car. The staff with the PPE provides the bag with the frozen meal. And of course, we have folks who, when they were coming to the senior center before the pandemic, did not drive to the senior center, but they took a bus that was organized and paid for by us, by the county, through a contract that the recreation department has with the Jewish Council for the Aging for the buses. So what we have done is for those folks who used to come to the senior center through this bus, now the bus driver takes the meals to the house. So that has worked really well. And I think it's going to be working like this for quite a while. We haven't heard anything about the governor allowed the senior centers to reopen, anytime soon. Another program that has been very much affected is our long-term care reimbursement program. That is a program that is mandated by the federal government, and we receive federal and state and county funds so that we have a team of staff who are trained and certified, and also a team of volunteers who are trained and certified, who prior to COVID would go to every facility in the county where we have long-term care residents, both nursing homes and assisted living facilities, to resolve problems. And so when COVID began, again, the directive from the Department of Aging at the state were that all visitations from staff and volunteers were to stop. And so the volunteers and staff up to now have been doing the best they can via telephone or Zoom calls. It has been very challenging because clearly in order to reach a resident, you have to go through the staff at the facility, to get the phone, to get the Zoom tablet. And the staff at the facility, as you can imagine, have been very much overwhelmed throughout this whole pandemic. The long-term care facilities have been seriously affected by the COVID virus for both residents and the staff members. Um, so now that the guidelines from CMS, the Center for Medicaid and Medicare Services, have been updated, just this week we have been informed that under a special set of circumstances, um, the volunteer ombudsman and or the staff member in the ombudsman program could do an outside visit with a resident and a family member and or a staff. Again, it has to be pre-approved by both the state and the county, and there has to be, extremely important reason why this is necessary to be done this way, outdoors, face to face. But at least right this week, we have been able to get started, and at least I know that one of them has been approved already for a site visit this week in the facility. So those are the main programs in aging and disability services that we operate ourselves. And I'm just proud to say that we have been able to continue our business. And clearly, it hasn't been business as usual. It has been very, very different. However, we are serving everyone who contacts us, and we urge people who need us to contact us. Or if you know of a person who needs us, please also contact us.
Thank you. And I'll just remind people, I say it with every episode, the best way to contact the Council's Aging and Disability Services Resource Unit is on 240 777 3000. I'll also include that in the description associated with this episode. So thank you, Odile, for that terrific overview of both the work that Aging and Disability Services does and how it's pivoted so well associated with COVID. Now, I really am aware that we as a county have very strong partnerships within non-profit agencies within our region. People are probably wondering, how have they been affected by COVID? Have you, can you share with us a few insights?
Oh, absolutely, and you are so correct. We are so very fortunate in our community to have fantastic non-profit agencies who are delivering outstanding services to our residents in the county. And so the first that comes to mind are all of the wonderful staff members who work in group homes. We have older adults, we have younger persons with disabilities who live in wonderful group homes in the county. And the employees of those group homes are called direct service providers, DSPs. The direct care staff has been absolutely awesome. You're talking about heroes, and they are clearly heroes in the community. Some of them have been working 24/7 for weeks and weeks. They have had cases of COVID in the group homes, and so they couldn't go back to their own homes to be with their family until the 14 days were over and the testing came back negative. It has really been very challenging for the group home personnel. And so I really want to praise the employees in those group homes. And by the way, the month of September, which is coming right along, middle of September, there is a national recognition for direct care professionals. So we will be sure to recognize them and celebrate all of their awesome work. Similar, we have a program called Adult Foster Care, whereby the county partners with families who have opened their doors and their hearts to a person in need to stay with them. And so our outdoor foster care providers equally have been absolutely outstanding. We had a online training for them as soon as this whole thing started to teach them about infection control and protective gear. Obviously, we were able to provide them with a mask. You recall at the beginning, you couldn't find a mask anywhere, and you couldn't find, the lotion for cleaning your hands. So at the very beginning, those logistics were very tough. Another program that has continued to work great is our SHIP program, Senior Health Insurance Program. We have a contract with a nonprofit agency called Jewish Council for the Aging, JCA, and they operate this program for us. And the program operates by a few staff members, really a few, it's just 1.5, and a wonderful network of terrific volunteers who are trained. I believe right now they have about 20 volunteers. So in the past, before COVID, obviously a person in need could call, but they could also make an appointment and meet face to face. So right now, every transaction is done over the telephone. So they are continuing to do their good work, but again, it is on the telephone. And so this is a program whereby anyone who has challenges, questions, issues with Medicare or Medicaid can call, and those folks are experts in problem solving. They know the rules, they know the appeal processes, they know who to talk to, Social Security Administration, etc. So again, I encourage everyone who has some issues related to Medicare, Medicaid, to contact us, and then we will make the connection to our SHIP contract. Another fabulous contract, and really you are very aware of this wonderful group, is the ARC of Montgomery County. We have a terrific contract with them for respite care. And respite care is a way to assist families who care for their loved one at home 24/7. So we would like to get them to get a little break when they need it. And so the break can be a person who's trained coming in your home and stay with your loved one, while you as a caregiver can go to the dentist or go to the grocery store or whatever you need to do and get a break. And so at the beginning of COVID, we did see that families were very hesitant in having a person come in their home because, of course, of the fear of catching the virus. But now that we have testing and we have more PPE available, families are more comfortable in opening their doors and letting this trained professional come and so that they can take care of their loved one and the family member can get a break. So we're happy to see that people are feeling more comfortable resuming taking advantage of this service. And the service, again, is available to families who care for a child with a disability, an adult with a disability, or an older adult. And we are allowed to provide 140 hours of service per year. That is the maximum we can afford per family. So we encourage, again, everyone who would benefit from this service to contact us, and we will make the connection with our Montgomery County. And then we have some other providers who have also been outstanding throughout the whole episode, and these are the home care agencies. We contract with agencies who have professional caregivers, and they have continued to perform their work, to go in people's homes, similar to our own employees that I mentioned before. Those, most of them are nonprofit agencies, but some of them are for-profit, have continued to go in people's homes and deliver much needed hands-on services. Similar to the respite, at the beginning, they also saw a decrease in the number of people who felt comfortable in having somebody come in their home, but that is beginning to turn around as well. So we're really happy to see that.
Thank you. And I want to remind our caregivers that the Alzheimer's Association, that also has a contract with Montgomery County, has done a really good job of transitioning all of their in-person support groups, education programs, memory cafes to the virtual platform. I will include a link to the Alzheimer's Association in the description with this episode. So Odile, thank you.
Really, yeah, thank you so much for all the work that you do with the Alzheimer's Association. And also I want to point out that on their website, they do have fantastic resources, videos, and also that all of their services are available in multiple languages. So you call on the phone, and if you need a different language, you tell them right away, and they can connect you with the language line service in any language. That's really fabulous.
Wonderful. Yes, thank you. So we are near the end of our interview, and so I'm sure that everyone is curious about what is the county's plan for the road to recovery for service delivery. What can you share with us today?
So I wish I had a crystal ball, but I don't really. The first question I hear from everybody is when our senior center is going to reopen. So clearly, I do not have the answer to this question. However, we are starting to plan for whenever we get the green light, how is that going to look like? So we are planning with our partners in the recreation department in terms of, what would be the logistics, because the facilities have only so much space, and how would we rotate different groups of folks, etc. So we are in the planning stages for that. Also, we have had a wonderful public partnership over the past 3 months, whereby we organized something we called a recovery work group for older adults and persons with disabilities. We meet every Friday morning. Our group is comprised of partners in the communities from our contract agencies, as well as our own staff in the service area. And we have focused on a couple of things. One, of course, was access to PPE. That is clearly, especially at the beginning, was such a challenge. And now we know that we have to have enough PPE in stock just in case some second big wave comes back again. So we have been focusing on access to PPE, testing, quarantine, and we have developed a number of recommendations that we need to present to our decision makers by middle of September. We also have focused on the fact that now that a lot of people are home and no longer going into the community, there is a lot of social isolation, difficulty of accessing services, and also people who had been volunteering face-to-face had to change gears altogether. So much in that area depends on technology. Clearly, we have a lot of people who do have access to technology, but we also have people who absolutely do not. So we are working with our county partners in the Department of Technology Services in trying to apply for grants that could allow the county to purchase some equipment, and then we could loan it to people who don't have the tablets, etc., etc. We also have been very fortunate to work closely with the recreation department and their COVID core members. Those are young people aged 16 to 24 who have been hired for the month of August. And we have quite a number of them who are helping us out. I think we have about 20 COVID core members who are tasked with contacting older adults or persons with disabilities who need technical assistance one-on-one on how to use your smartphone, your Zoom, etc. And so we are very happy that this has been in place for us in the county. And this program is available only through the month of August. So again, encourage anybody who is watching this to contact us for 311 or call us in Aging and Disability Services and say, hey, I could really get some help here. I've got this thing and I don't even know how to do this and that. So please take advantage of that. And we will evaluate the program at the end of the month when it's done to make recommendations for what worked and can we expand this program in a different way beyond August? So another area that we have been looking at is provider sustainability. As you can imagine, the financial crisis is on top of the medical crisis in our community. And so many providers have been facing difficult financial situations. Some providers have to let go of employees because of that. Their revenues have drastically reduced, and they had to lay off some of their employees. So we are looking at all of these serious issues. We have done 3 surveys. One survey was of the medical adult day providers in the county. Another survey has been of the home care agencies, and then a survey of the providers of services to persons with developmental disabilities. So we are analyzing the results of the survey to develop recommendations that we can pass on to the decision makers.
It's very impressive how Montgomery County is so thorough in acknowledging that it's a public-private partnership that's going to be essential both previously and as we move forward. So we're now at the end of our interview. Are there any closing thoughts that you would like to leave our audience with?
I really want to say, as much as all of these past months have been extremely painful, I also want to say that many people lift my spirits and other people's spirits every day through the amazing work they do. We have volunteers in the community who just come out of the woodwork and do amazing things. Food drives, delivering meals to people, delivering toilet paper. Remember way back when you couldn't find a roll of toilet paper for the life of you. We have had incredible neighbors helping each other. And I also want to point out that we have this wonderful initiative in the county that is called Villages. And so villages are neighbors helping neighbors age in their homes. And so we have had quite a network of 30 villages in the county. Again, fantastic volunteers who are doing incredible work in helping their neighbors in need. And again, anyone interested in this particular initiative, feel free to give us a call or look us up. And also, I want to point out a brand new initiative that is under development that is called home sharing. And in the house, they have an empty bedroom, and they would like very much to be able to rent it to a person that they can trust and have a long-term rental relationship with. So we are about to sign a contract with a nonprofit agency who is going to get that program going. So we are in final stages of contract negotiation with our office of procurement. And so if you are interested, you can start to contact us and let us know, because that's going to be really wonderful to know that people who have a place in their home, who want someone, would be able to be matched with a reliable person and possibly develop a friendship, a long-lasting relationship that is a win-win for everybody.
Thank you, Odile. And I want to remind everyone that if you do need immediate assistance as a caregiver or someone with a disability, contact the county's Aging and Disability Services on 240-777-3000. So this is another Engage at Home episode brought to you by the county's Caregiver Support Program. I want to thank you for being our audience, and please remember to stay calm.